When it comes to diabetes, we spend a lot of our time talking about high blood sugar levels, but we don't spend a heck of a lot of time talking about low blood sugar levels, which is just as important, if not more important. So today, let's have a look at what to do when your blood sugar level is too low. Hi, I'm Charlotte from Habits for Health. I'm a dietitian and a diabetes educator, which means it's my job to teach you more about your diabetes so that you can rely less on people like me and your GP to guide your diabetes journey. So today we're going to talk about low blood sugar level, or hypoglycemia, or hypos. So a hypo is when your blood sugar level gets too low that it actually can make you ill, and if it goes on too long, it can actually be fatal. So we don't want that to be happening. It's more likely for people who are on insulin, but it's always good just to be aware for everyone so that no surprises, right? So what is a hypo? A hypo is when your blood sugar level is less than 4. Some people may start experiencing symptoms of a hypo a little bit higher than a level of 4, so maybe around 4.5. So it's really important that you're really paying attention to your body to figure out what counts as a hypo for you. But certainly if your blood sugar level is less than 4, we definitely want to treat it as a hypo. And the symptoms of a hypo are things like being really shaky, feeling really confused, fatigued, extra hungry. Basically, if you're just feeling a little bit off, then I would always say just check your blood sugar level, make sure that it's not your blood sugar that is causing the problem. So when you do notice that you're having a hypo and you've tested your blood sugar level and it's less than 4, what are we going to do? So the first thing that you want to do is, first of all, just sit down and stop using up extra energy. And then you want to be having some kind of quick-acting sugar. So quick-acting sugar is like, 5 or 7 jelly beans, or a little bit of juice, or regular soft drink, not diet soft drink, or you can also use those glucogels that you get from the pharmacy that are really disgusting, because then at least you're not tempted to have them any other time. So you really want some kind of really quick acting carbohydrate, and it should be about 15 grams of carb. And the reason for that is that it's going to get into your system really, really quickly. So we want something that is really fast acting. Of course, if you know much about diabetes and maybe glycemic index, you're probably already aware that, hey, these are not going to hang around in my system for very long. They're going to bring your blood sugar levels up really quick, and then they're going to really drop off very quickly as well. So the idea is, you have your fast-acting carbohydrate and you wait 15 minutes. Now, a lot of people skip the 15-minute wait because they think, oh, I'll just go and have some kind of toast or something that's going to, help stabilize my blood sugar levels. And that's definitely a really important part, but we don't want to skip the 15-minute wait, because if you're eating a low and slow carb at the same time as your fast-acting carb, then you're really just making it harder for your blood sugar level to get up. You're really delaying the absorption of those jelly beans or that juice or whatever it is. So you have your jelly beans, your juice, your glucogel, whatever. You wait 15 minutes. After that 15 minutes, test again. If your blood sugar level is now up above 4 and you're starting to feel a bit better, then perfect. It's probably safe for you to go ahead and have that low and slow carbohydrate. So some whole grain toast, yogurt, fruit, a bit of milk, or a meal, like something with rice or potatoes or pasta. If your blood sugar level is not up above 4, or if you're still feeling symptoms and you're sitting around, 4, then maybe you want to go back and have another round of those quick-acting carbohydrates. So again, you take your quick-acting and you wait 15 minutes and you test again and see if it's come up. You can repeat this cycle, this process, about 3 times. And if after that time your blood sugar level has not come up above 4, then you need to go to the hospital. And obviously you can't drive yourself there because that's dangerous. So you need to get someone to take you or call an ambulance. And the reason for that is obviously something's not quite right. Either you've taken too much insulin, or maybe you're sick. We don't know what the cause is, but your body isn't able to stabilize your blood sugar levels, and that's a real problem. That's when, unfortunately, people can actually slip into a coma and potentially die. So it's really important that if your blood sugar level is not stabilizing, then you do take the appropriate action. Now, I know this sounds really severe and significant. It's quite uncommon, As I said, some people may not notice when they get the symptoms of a hypo. Usually people with type 1 who've had multiple hypos can basically just lose their ability to notice a hypo. So it's more important that you have something like a CGM that will tell you an alert when your blood sugar level is low. So the main points are, make sure you test if you're feeling unwell in any form, and just check that it's not a hypo. If it's a hypo, you treat it with some fast-acting carbohydrates, something really sugary. That's about 15 grams of sugar. Wait 15 minutes, and then if it's up above 4, you can add in some long-acting carbs. If it's not, repeat the process up to 3 times. If it's still a problem, go to the hospital or get someone, call an ambulance, something like that. So I hope this helps you understand how we manage a hypo. It's really important that even if you're not regularly having a hypo, you understand what the process is, and maybe someone around you also can help identify a hypo and knows how to treat it. It's more likely that a hypo is going to be a problem if you are type 1 or on insulin, or there are some type 2 diabetes medications which also increase the risk of a hypo. So it's good to check what kind of medications you're on and whether they have an increased risk of a hypo. Metformin, for example, has a really low risk of a hypo, whereas something like a sulfonylurea has quite a higher risk of a hypo. So it's quite important to just be aware of your risk and just know how to treat it. It's very easy to manage as long as you know what to look for. So I hope that helps you understand what we do for a hypo, how serious it is, and how important it is that you're prepared for it. Until next time, take care of yourselves, and I'll see you in the next video. See ya!